Moving on to your joints, any place where two or more bones come together is considered a joint. So the bones are kept from rubbing together again by the cartilage. Your bones are held in place by the ligaments. Again, ligaments hold bone and bone. Tendons hold muscles and bones. Your ligaments are tough bands of tissue that connect the bones to the bones. You have something called an immovable joint, which allows little to no movement. Or they call them fixed joints. Your skull would be considered fixed joints because you do have different pieces of your skull, but they do a really nice job of forming together to make one big protective piece for you. And parts of your pelvis are fairly immovable. You have more function here in your hip sockets. You have 4 movable joints. You have pivot joints, ball and socket joints, hinge joints, and then there's gliding joints. And I'm going to ask you for those on your worksheet, and then I'm going to ask you for an example of where you can find these. So, pivot joints is when one bone rotates in a ring of another bone that doesn't move. So your neck would be considered a pivot joint. You can turn your head side to side. I mean, you can look up and down, but you cannot like rotate it around. It doesn't have freedom to go in many other directions. So that would be considered pivoting. Ball and socket joints consists of a bone with a rounded end that fits into a cup-like cavity on the other bone. So here we have your hip bone and the head of your femur, which is the upper bone in your leg. So your hip socket joint would be considered a ball and socket joint. You have a lot of range and mobility of your leg. It can go basically in any direction. And then up in your arm, under your scapula, you have a place where the head of your humerus is going to connect. So you have a lot of, 360 rotation. We can rotate our arms around in pretty much any direction. They don't just have a one-way range of motion. So ball and socket joints are going to have a large range of motion. We also have something called a hinge joint, and if you think of it, it has like a back and forth movement like hinges on a door. So your arm would be an example of a hinge joint. It can go up and as far up as it wants to, but then when it goes down, it doesn't go past that 180 degrees unless you have, extra bendy joints. You're double jointed. I have this in my arms and my legs. Then it will have a little bit of give, but again, we can't bend our arm backwards the other way. So our arm has hinge joints. Our knee would be considered a hinge joint because we can straighten our leg. We cannot bend our leg up towards the ceiling. That would mean it was broken. So those would be examples of hinge joints. And then you have something called a gliding joint, where one part of the bone slides over another part of the bone. So when you're moving your wrist back and forth, you have a lot of bones in your hand. If you can see here, there's a lot of small bones up in your wrist-like area. So your wrists would be gliding, and then this would also be in your feet as well. So your ankles would be considered gliding. It depends what movement you are doing, but they would have some overlap. When you rub two pieces of chalk together, their surface begins to wear away and then it gets reshaped. Without the protection of the cartilage at the end of your bones would also wear away at the joints. So again, this is why cartilage is so important. It's important to take care of your joints and not, abuse your body and use it and be careless with it, because cartilage, again, once it's gone, like that chalk, once you rub the chalk together, it's not going to magically reform. Once it's gone, and that's when people have hip and knee replacements. Obviously, that's why, maybe your grandma or grandpa has gotten one, because they're old and they've walked on this planet, maybe 60 some more years than you. So it's more likely to happen when you're older. But again, if you're like a professional athlete, you're more likely to have risk of this, or, professional dancers all the time using wear on their joints, football players, people like that, running. My dad's had a few knee surgeries because he is a hardcore softball player. He plays all year round, so the knees is a big one that gets worn away too. More common joint problems. You've probably heard of these. You're just not 100% sure what they are, but arthritis is just kind of the blanket term for, 100 different diseases that can damage the joint. So if someone says arthritis, it's like they could have a whole bunch of different versions of it, but the more common two are osteoarthritis, is when your cartilage breaks down from years of use. So again, the older you get, the more likely you are to develop this arthritis. But then you can also be born with something called rheumatoid arthritis, where your body's immune system tries to destroy its own tissue. Which, again, that doesn't sound good. It's not good, but there is sometimes where our body, will attack itself, and it's not supposed to, but there are drugs and therapies that you can do to correct those types of diseases, and arthritis is one of those diseases that it can happen. But the osteoarthritis is probably the most common. Just over years of use, your cartilage is going to break away, and you're not going to magically get more, so take care of your joints now. Other skeletal problems, if you're thinking of, the last time you broke a bone, this can be because of an injury. If you were in an accident or playing a sport, you could have an infection that could cause this to happen. You could have poor posture that could cause some of these to happen, or a lack of nutritious foods. Again, getting all the minerals that you need in your body, all the calcium, all the phosphate. So, injury, you're most likely to fracture or dislocate due to an injury. It's a break in a bone caused by an injury. Fracture doesn't necessarily mean the bone's completely snapped in half. It could be a crack in your bone. I fractured my knee in 3 places playing softball, and it was chipped, it was cracked, it was essentially broken, but I didn't snap my knee in half. And when people hear break, they think of you snapped it in half. But a fracture is still considered a break, and it could be as easy as, a crack. You could have a dislocation. This occurs when a bone's pushed out of its joint, usually stretching or tearing the ligaments with it. You're most likely to dislocate a shoulder, but people also dislocate their hips. Anywhere you have a ball and socket joint is where you're most likely to dislocate, but ow. You can dislocate any joint. It would be very dangerous to dislocate your neck from your skeleton. That could cause death. You could have a sprain. This occurs when a ligament in the joint are stretched or twist and cause swelling. So if you ever sprain your ankle and it swells, it's most likely because you twisted or stretched your ligaments a little too much. And again, just resting them can help solve the problem. Scoliosis, you've probably heard of. I used to get tested for this all the time in school. I don't know if they test people for this anymore in school, but basically the doctor or nurse or whoever just looks at the curvature of your spine. So this is if your spine curves to one side of the body and it's not straight. It can have a slight S or C shape to it. This can cause a lot of back pain and difficulty breathing. A lot of people are born with scoliosis, but again, this is something that could happen just for bad posture. You can get a permanent sway in your back from sitting poorly. And a lot of people have hunchbacks these days from sitting and playing video games and being on their computer. Not a lot of people sit up super straight anymore, so it's worth thinking about your posture and your backbones. We're not working with books right now. I don't know if you guys have yellow health books. This is from my old school, but I gave you an extra credit opportunity because I think it's important to learn some of the major bones in your body, and we'll talk about them more throughout the year. I might quiz you randomly in PE and be like, hey, Sarah, where's your clavicle? Because why not? But on your worksheet, it's going to ask you for extra credit opportunities. If you want to go ahead and just like draw a skeleton and show me your artistic artwork, more bonus points for you. That's amazing. If you want to print one off the computer, if you want to trace one yourself, if you want me to give you a printout of a skeleton, I gladly will. And you're just going to label these on the skeleton. I obviously don't want you to guess, so use your resources to figure out where they are. What I don't want you to do is print off an already labeled picture off the internet. That is zero effort, 0 out of 0. So again, just a nice little extra credit opportunity for you guys. The prettier you make it, the nicer it looks, and I can like hang it up and everyone can look at it. But your major ones are going to be your skull, which I hope you already know, clavicle, scapula, rib cage, your sternum, your humerus, radius ulna. I skipped your carpals and metacarpals. Those are in your wrist. I'm not going to worry about them. You have phalanges in the upper part of your body. You have something called a pubis, a femur, a patella, a tibia, a fibula. I skipped tarsal bones and metatarsal bones. Those are in your ankles. And then you have phalanges in the lower part of your body. So most of these should hopefully sound familiar to you. But again, extra credit, bonus points if you bring me a piece of paper with a beautifully drawn trace printed skeleton and you label the bones that I asked you to. It's nowhere near all 206, but these are what I would consider to be the main bones in your body. Ask if you have questions. Let me know if you want a printout of a skeleton. I'll have them with me in gym next week. I'll try to remember. I'm going to go print some now so I have them. But I don't want you to have to do too much work. But I do want you to do, maybe see if you can label them before you look up where they are and see how many of these you know. I believe that's the end of the PowerPoint. Happy learning!